first-rate hospital is really going to be vital to our continued economic vitality and quality of life. Not only for attracting and retaining top-flight medical professionals, but really all businesses.
When we're looking to attract and retain quality employees from all over the country, one of their first questions is, what are the schools like? What is the healthcare like?
When our local workforce has adequate healthcare readily available to them, it takes absenteeism out of the picture due to healthcare related issues. Employers benefit from that.
It's going to put a lot of people to work building that facility. And over the long term, anything that increases the amenities in the community makes it more attractive to retirees who buy homes and support property values, or businesses when they're choosing to locate or to stay in a location. Anything that raises the quality of life makes this a more attractive place for folks to be.
In my case, I am in full support of a bond measure to build new facilities as well as bring up to date the existing structures. When we looked at retiring, finding a place with medical services easily accessible was one of the criteria on our list for finding a place to live. Looking at the potential for this new building and the services it can provide, I can see people looking to retire here that this would be a big draw.
There's a lot of competition in the medical field for recruiting new docs, particularly, and nurses and technicians and everybody. We're in a competition for getting those good people.
And it's much easier to attract young providers when you have a new clinic with new services. These new doctors expect up-to-date equipment. That's how they're trained, and that's what they need to do their job. It also helps us keep the providers that are already here. It helps keep them from wanting to leave and go to a big city where there's more stuff, so to speak.
Newport is growing, Lincoln County is growing, and the need is growing. We have no room for physicians to set up an office. We have no room to expand.
We've put equipment into our department, but we're running out of room to put it, and we're running out of room to put patients. And so our biggest need is, at this point, just the physical space to be able to get patients in rooms so that their wait time is less and that they are able to get access to care quicker.
Cardiac rehab here means going in and preparing yourself. You weigh, you attach receivers and wires to a little monitor. You have a little room that stores wheelchairs, oxygen tanks, other medical supplies, with a curtain and a toilet and a bathroom.
We are limited by the number of exam rooms. It's one room per provider, which really is not enough.
As the population ages, we see more and more cancer patients. We also treat other patients here for blood transfusions. Sometimes in the rooms we have families that come too, so that we're kind of bursting at the seams.
I'm also a patient here at Samaritan Pacific Communities Hospital on an ongoing basis. I come here for 2 days a month for almost full-day treatments, and I consider myself very lucky to be able to receive them here. Because of limited space and availability of staff, some people are having to leave the area for their chemotherapy treatments, and that is very difficult, especially if they need them more than one day in a row.
These providers that we have in our town in Newport are wonderful. They've been doing as much as they possibly can do with what they have, but we can do so much more. We have great physicians here, and we have great potential to increase access, increase services. We just need the room, the supplies and equipment to be able to do that.
This is actually our boss's room, but because we have no room for supplies, we have all of our wound supplies for the patients. We have our IV supplies for PICC cares. So we use every inch of space in this hospital.
The new building will feature nearly twice the square footage to house physician practices. That will enable us to recruit more providers, which will, of course, increase the access to our community and patients to services. Presently today, if we recruited a new physician tomorrow, we have no place to put them.
When we build this new hospital, All the primary care clinics and the surgery clinics, the specialty clinics, etc. will be in one building, and it will be very convenient for our residents here.
It would be great to have vascular coverage without having to go to the valley. Things would move along faster. They wouldn't be put on a waiting list. And each step of the way, wouldn't take a month to get the treatment that they're waiting for.
This new facility will help provide those services, not just now, not just next year, but as we grow into our future, we'll have those things available for our residents, for your children, and hopefully for your grandchildren, and have a facility that when people drive by, they can say, look at our beautiful new hospital. It really does provide excellent services, excellent care.
I think by investing in a new hospital, the community really does show that they are invested in the healthcare of their citizens. And from the emergency department physicians all the way to primary care physicians coming into the community, when they see that, it makes it easier to come and work for an organization where they feel valued.
It's vital not only for our community, it's vital for the visitors that come to our county. It's vital for those of us that live here that really want to stay here and keep our dollars within this wonderful county of ours. We don't want to go to the valley for services. We want to be able to just come right down the street to our wonderful hospital here in Newport, and to have updated facilities and something that people can be proud of.
To recruit more providers.
To be able to get patients in rooms.
To stay current with new technology.
To have vascular coverage.
To provide the services people need in their own communities.
And get 80 to 90% of their care just right here.
It's so very important.
To our continued economic vitality and quality of life.